Welcome everyone to the statewide Medicaid Managed Care Long-Term Care Program webinar for long-term care potential network providers. This presentation is part of a series designed to teach you about statewide Medicaid Managed Care Long-Term Care Program. In particular, this presentation will teach you about plan of care in the statewide Medicaid Managed Care Long-Term Care Program. To access today's presentation, please follow the link below to the SMMC website. That would be AHCA.myflorida.com/SMMC and select the News and Events tab under the header image. Note, you can also use the red button to sign up for SMMC program updates via email. Next, please select Event Materials to download today's presentation. You may also view details regarding future SMMC events using the Upcoming Events tab. Last, choose the files you would like to save. Another note, you may also view files from past events and AHCA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce you to today's presenter. We have Eunice Medina with the Department of Elder Affairs.
Good afternoon, everyone. The purpose of this webinar is to discuss the recipient care plan upload, the required documents being uploaded, how case management providers will receive access to the File Transfer Protocol or FTP site, step-by-step upload instructions, and the transfer of recipient information. According to legislation passed in 2011, recipients enrolled in the following programs will transition into the statewide Medicaid Managed Care Long-Term Care Program: the Age and Disabled Adult, Assisted Living, Channeling, Frail Elder, and the Nursing Home Diversion Program. The purpose and goal of the recipient data upload is to ensure there is no disruption in services for existing waiver recipients transitioning into the statewide Medicaid Managed Care Long-Term Care Program, or the new program. The following actions are contractually required for existing nursing home diversion managed care organizations and waiver case management agencies. Existing providers must upload current care plans and service authorizations for all existing waiver and frail elder program recipients to the state. Each new program managed care plan must retrieve the information and act to ensure and guarantee the continuation of each recipient's current services for up to 60 days or until the recipient receives a new assessment and a new plan of care is developed and agreed upon with the enrollee. In order for the new managed care plans to ensure the continuation of waiver services for existing waiver recipients, all current nursing home diversion and frail elder managed care organizations and age and disabled adult, assisted living, and channeling waiver case management agencies must upload specific client information, including care plans and service authorizations as outlined in this presentation. The recipient data upload consists of all active recipients receiving services through the programs included in the transition to the statewide Medicaid Managed Care Long-Term Care Program. Prior to uploading the requested recipient information, each managed care organization and case management agency will receive a list of the following information from your state contract manager for all current recipients. For the ADA and AL waiver programs, you will receive your list from the local Aging and Disability Resource Center. For frail elder and nursing home diversion and channeling, you will receive it from your state contract manager. This information will include the Social Security number, date of birth, first name, last name, and the planning and service area. Managed care organizations and case management agencies will need to check this list against their recipient records and report any missing recipients and/or discrepancies in recipient information to your state contract manager or ADRC. The following recipient file information must be combined into one PDF document for each recipient and uploaded to a joint AHCA-DOEA File Transfer Protocol or FTP site. The information on this PDF will be the current care plan, current service authorizations for those that are fee-for-service providers, and the optional 701B assessment. For example, if your managed care organization or case management agency has 50 recipients, you will have 50 PDF submissions, one for each recipient. On a side note, for those in the Age and Disabled Adult Waiver Program who are receiving their services through the CDC Plus program, they will only have their own ADA waiver care plan uploaded as they do not have service authorizations. The PDF document submitted for each recipient must have the following naming convention: Social Security, date of birth with 2 digits for the month, 2 digits for the day, and 4 digits for the year. For example, if waiver recipient John Doe's SSN is 123456789 and his birth date is January 21, 1931, then his file would be named 123456789_01211931. As stated in the client upload letters for the managed care plans and case management agencies, a designated staff person's name and email address were to be sent to the Department of Elder Affairs email address within 5 business days of receipt of the letter. After receiving a list from all the managed care plans and case management agencies, DOEA will compile these contacts and provide them by area to the Agency for Healthcare Administration. Before each area is scheduled to begin uploading the client information, each managed care plan and case management agency's designated staff person will receive their username and password from the Agency for Healthcare Administration in order to access the FTP site. As you can see on this upload or FTP upload schedule, right now Regions 7, 8, and 9 are in the process of uploading their care plans. We have received a lot of questions about what if someone becomes active after the upload deadline, or what if there is a change to the care plan after the upload deadline. Right now, we are only requiring that case management agencies and managed care organizations upload for those recipients that are active during this upload schedule. Each region has approximately 2 months to complete the file upload. We have received a lot of questions, like I already mentioned, about the fact that if they get updated to, if it's after the deadline, to go ahead and only upload the ones that are active during their time period. After you have received your username and password for FTP site access, managed care organizations and case management agencies will take the following steps to successfully upload all the requested client information. In Step 1, you will go to the FileZilla website listed here in Step 1. In Step 2, save the compressed FileZilla FTP client folder by choosing Save and Not Open and save the file to your hard drive. In Step 3, once downloaded, double-click the FileZilla icon to open the Site Manager. In the left-hand corner of the FileZilla window, you will click on the File option, which will open a drop-down box where you can select Site Manager. The Site Manager will open in a separate window, giving you the option to select New Site, which you will click on. After clicking New Site, you will be prompted to change the setting and type in your username and password. Match the settings to this screenshot. Type in your username and password and click on the Connect button. If another box appears like the one in this screenshot stating that the server's host key is unknown, click OK to continue. Next, click on the file in the right-hand box titled with your username. After you have clicked on the folder with your username, select the PSA in which the client whose information you are uploading resides. Then drag the client file from your computer to the FTP site. If you are using FileZilla from your desktop, you may drag more than one file at a time to be uploaded to the FTP site. After each PSA completes their client upload, the information will be reviewed by AHCA and DOEA to ensure the requested information is included. AHCA will then provide the client documentation to the new managed care plan for each recipient.
At this time, we are done with the presentation portion of today's webinar. Please take note of the resource page that is up at the moment. If you would like to send your questions in, if you know they're a little bit more technical, you can send them into FL Medicaid Managed Care at AHCA.myflorida.com. Once again, that email address is flmedicaidmanagedcare@ahca.myflorida.com. And once again, you can receive updates about the SMMC program at ahca.myflorida.com/SMMC. And you can get, if you click on the upcoming events news tab, you can sign up on the mailing list, and you will receive email updates about the program, including when we host the webinars.